This video continues OEC 6, Chapter 21, Spine, Brain, and Nervous System Injuries. In this video, we want to look at common injuries that could be encountered. Our objectives are to define TBIs and describe traumatic injuries involving the spine. We may look at the signs and symptoms of spinal injuries and the signs and symptoms of traumatic brain injury. Key terms include cerebral contusion, concussion, coupe-contra-coupe brain injury, epidural, intracerebral, and subdural hematomas, and retrograde and antegrade amnesia. Injuries to the brain and spinal cord can be divided into closed and open CNS injuries. In a closed CNS injury, the integrity of the skull or spinal column is not compromised. In an open CNS injury, the brain or spinal cord may be exposed and cerebrospinal fluid may be leaking from the cavity. Soft tissue injuries may accompany skull fractures. Signs of skull fractures may include a depression over the fracture, cerebrospinal fluid leaking from the ears, or bruising beneath the eyes, sometimes called raccoon eyes, or bruising behind one ear, also called battle sign. In a coupe-contra-coupe brain injury, the brain keeps moving forward and strikes the inside of the skull, the coupe, then rebounds in the other direction and strikes the skull on the other side. Swelling and bleeding from these two events will create intracranial pressure, pressure within the skull, a key medical prefix, intra. Traumatic brain injuries can be of several types. These are mechanical injuries to the brain that result in short or long-term neurological deficit. We can look more closely at these effects. The long-term effects of a TBI may include memory loss and reduced problem-solving capacity, emotional issues such as stress or anger management issues or depression, and functional changes in learning or emotions. Later in life, there may be an increased risk of Alzheimer's or Parkinson's. A concussion is a TBI caused by temporary disruption of brain function. They range from mild to moderate to severe, and we may see this in terms of signs or symptoms of loss of responsiveness from no loss of responsiveness to LOR lasting less than 5 minutes or LOR greater than 5 minutes. Amnesia, the idea of forgetting, can be classified in two types. Retrograde amnesia is no recollection of events prior to the injury. Antegrade amnesia is characterized by no recollection of events after the injury. These may be accompanied by perseveration, that is, the patient being stuck on a particular speech pattern, such as repeating, "What happened? What happened? What happened?" Another type of TBI is a cerebral contusion, that is simply a brain bruise. This is due to the rupture of small superficial blood vessels in the brain, and its effects are localized. Hematomas are the greater form of bleeding in the brain, and they may occur epidurally, that is, the result of an arterial bleed between the skull and the dura mater. Generally, this could be the result of blunt trauma causing a skull fracture, and the onset of signs and symptoms is very rapid. Initially, the patient may be unresponsive, and then this is followed by a lucid interval. We contrast the epidural hematoma with a subdural hematoma, and this is different in that it is a collection of venous blood and it occurs below the dura, between the dura mater and the brain. often caused by rapid deceleration injuries. An intracerebral hematoma occurs within the brain, and this is due to blood vessels inside rupturing, and they may occur spontaneously or occasionally from trauma, but they're certainly life-threatening because of the rapid rise in intracranial pressure. The final type of traumatic brain injury to consider is a diffuse axonal injury. An axon is the long, slender projection of a neuron, that is, a nervous system cell. If we have a high velocity rotation or deceleration MOI, we can see shearing of the axon, and in the post-traumatic situation, the patient may become unresponsive. Spinal injuries may include fractures of the vertebrae from any one of the MOIs that we've discussed in Chapter 18, that is, blunt trauma, penetrating trauma, or these ideas of hyperflexion and hyperextension or rotation, specifically in the cervical and lumbar regions of the spine. Fractures of the cervical spine are very dangerous because they can result in paralysis of the arms and legs, or they may result in decreased signals to the phrenic nerves, resulting in a patient who is unable to breathe. Without rapid intervention, these patients may die. Vertebrae of the thoracic spine are typically protected from rotational injuries by the rib cage. However, you may experience a compression fracture in a thoracic vertebrae. Most common fractures of the spine occur in the lower thoracic or lumbar areas or at the junction of the two. Men experience this 4 times more frequently than do women, typically due to twisting forces or compression or deceleration. Injury of the sacral vertebrae or the coccyx are different in that these two regions of the spinal column are fused. Injury of the sacrum is very rare. Fracture of the coccyx is common, particularly if a person falls onto their buttocks. Neurogenic shock may result from injuries to the spinal cord. Keep in mind that these injuries are of 2 types: a direct injury to the spinal cord, in which a broken or displaced vertebrae puts pressure on the cord, or by indirect injury, that is, while the bony part of the spinal canal does not put pressure on the spinal cord itself, the pressure from a hematoma inside or swelling may put pressure on the spinal cord. Now, this neurogenic shock is a disruption to the autonomic nervous system. As a result, peripheral blood vessels dilate. In the framework of shock, this is not a problem with the pump. This is not a problem with the fluid. It is specifically a problem with the pipes. We can see a precipitous drop in blood pressure due to this vasodilation, and it's also accompanied by bradycardia, that is, a slow heart rate. This is a potentially life-threatening complication of spinal trauma. In summary, OEC technicians must safely manage patients with traumatic head and spine injuries in an effort to minimize additional injury.